As social distancing becomes the norm of our everyday life, the cable wants you, our customer, that we are here for you every day. Just log into us on Facebook, Instagram, and YouTube. Send us your feedback at email customerservice@thecable.biz. Visit our website www.thecable.net. It's also nice to know you can pay your bills at a distance, online at all commercial banks, or at www.thecable.net/pay. Now's the time to try online banking. It's ultra easy. Call us at 465-2588, 662-7742, or 763-0184. The Cable. We're here for you.
Well, a very good afternoon to you, and of course, thank you so much for choosing Win FM 90.9. We are Inside the News. We say good afternoon to our partner stations as well, ZAZ, Sugar City Rock, and others who are listening to the broadcast as well, as we continue with the Prime Minister of St. Kitts and Nevis, Dr. Timothy-Harris, and the Permanent Secretary, Dr. Delores Stapleton-Harris, on Inside the News today. A number of questions were asked and answered in the first segment. We continue in the second segment. I think one question that may have escaped attention is the one about delivery of supplies in an effort to reduce the number of people who are out and about shopping. So we go back to the Prime Minister and to the Permanent Secretary. Good afternoon, Mr. Prime Minister. You're live.
Thanks. Very quickly, with respect to that, I would make the following observations. One, the supply chain is still very strong in St. Kitts and Nevis. That is, there has been no disruption of the normal cargo vessels bringing food to our country. So food and beverages we have in abundance. In a prior statement, having consulted with the supermarkets or the large wholesalers in the country, we had confirmation that we have enough items to last for almost 2 months. Additionally, every week, containers are coming in. I believe about 50 of them came in during the course of this week, bringing in food and beverages. So there is no absence of food. So one will therefore have to weigh the costs and the other hustles involved in sending food for persons to go to clear them from one port or the other, and all the interactions are going to happen there. As opposed, for example, if I were to send cash, it goes to one source, they collect, they go to the supermarkets, they can have what they need. So food is not a scarcity, and that is why we also do not need people to overcrowd the supermarkets, because food would be there for a very long while once people act normally as they ought to, even in these difficult times. We have enough food and beverages to last for 2 months, and every week the major vessels still come to the country, bringing, as it were, additional supplies. So the caller will have to take that particular consideration on board. We will appreciate any support for more effectiveness with respect to our popular poverty alleviation program. This program provides support for over 4,000 households who earn an income below $3,000, and a $500 assistance package is being provided. The caller can contact the Permanent Secretary in the Ministry of Sustainable Development, Mrs. Elvita Simpson Brown, for further information as to how his entity or his associates can provide assistance in executing of that particular matter. The question of special facilitation for government workers. All government workers who are required are in fact facilitated. Going back to the regulations or the Emergency Powers COVID-19 regulations identified those persons who are considered essential officers of the government. The list includes the Royal St. Christopher Nevis Police Force, the St. Christopher Nevis Defense Force, the Fire and Rescue Services, workers at NEMA, the Nevis Disaster Management Department, the National Emergency Operating Center, the Health Emergency Operating Center, and any other disaster management services, the prisons, the correctional facilities, or other similar establishments, any hospital, health center, or medical facility, Customs Department, Immigration Department, Air and Supports Authorities, essential media personnel of a media house, the Office of the Director of Public Prosecution, the Attorney General's Chambers, Members of Parliament, Secretary to the Cabinet, and it says all essential workers shall at all times carry personal identification. Water, electricity, and other sectors involved in electronic communications, including print and electronic media. That is at Regulation 8, Subregulation 2. So they are covered, they are provided for, and that is why, for example, even where they were not provided, if a reasonable case can be made, the Commissioner of Police on the regulation, I think it is 6, can in fact provide some measure of exemption to that particular person or entity. It is because we have made those provisions for the continuity of government activities, notwithstanding the pandemic, why the Treasury was able to pay over 1,000 plus employees of the government their weekly wages. And that is why also the step workers were paid. And we are talking there in St. Kitts and Nevis close to another 3,000 plus employees. So it shows that the government is appropriately covered and there have been no issues in that regard. If there are, because it is a learning process, as I admitted earlier, and we will make the necessary refinements. So I thank the caller for raising those. But in this particular case, we have covered this in the regulation in a very direct way. I believe Madam Pierce may want to say a word, but just to add how helpful this program has been, I've been advised that we have one other producer of the mask, and that is, what's the name? Let me just check my WhatsApp, because persons wanted me to add that name. Perhaps the PS can do her do, and then I will just give the name so that we have a complete picture of what is happening in the country at this time in relation to production.
Thank you, Prime Minister. I also wanted to support your articulations regarding the mask and to reinforce that while it is not mandatory, it is an option that we would want to see embraced by the people of the Federation. I want to remind you that the virus is spread through the air by coughing and sneezing, by close personal contact, by touching an object or surface contaminated with the virus. And so it is almost imperative that persons protect themselves, protect their loved ones, protect the Federation from the transmission of the virus by wearing the mask. I also want us to embrace the principle of each one help one. And let us ask ourselves the question, are we willing to put ourselves and our family and our loved ones at risk by not wearing a mask? I leave you to answer that question. In terms of the other question that was asked about natural remedies regarding the COVID-19, I wish I could say that there were or there are natural remedies available. Unfortunately, there is none known, but we have been espousing measures to promote health in terms of building one's immune system, drinking adequate amounts of water, taking supplements of vitamins, engaging in exercise, and taking prescribed medication. I believe it is important for us to be mindful of the fact that while there is a very natural inclination for us to turn towards natural and homegrown substances like the bush, etc., we have to be very mindful of the interaction of these bush material and prescribed medication. And so I would advise individuals and persons with that inclination to check with their physician, their district medical officer, or the nurse for any clarification, any advice regarding such natural remedies. Thank you.
And thank you very much. We'll now go back to the phone lines and give you a chance to interact with the Prime Minister and the Permanent Secretary. Our numbers are 4660989, 6620989, 7620989. We have a caller. Call you live and on the air. Good afternoon to you.
Good afternoon, Mr. Bakai.
Good afternoon, my dear. Good afternoon.
Hold on, let me turn down this. Oh, God. Okay. Good afternoon, PM. How are you today? This is Thank Unity.
I am good.
Well, I just want to congratulate you. You're doing a very good job. I think you're working off the clock. And remember, in real life, anything you do, you can't please everybody. Some gone sad and some gone glad. But with you, what you're doing, I think you're trying to please everyone, but you know how it is right now. And I want you to keep on doing the goodwill of the people in our St. Kitts and Nevis. And Prime Minister, I hear somebody saying that you need to get together and the opposition needs to get together. But I hear you say something will happen in Nevis. So when I finish, you could please explain to it to me, please. Okay?
All right.
And with this team unity government, the government is not perfect, but you're doing your best. And I see something ahead, the next gen SKN, I see a bright future ahead of them under the team unity government. So you keep on doing the good work, right? You look so good. You're coming to getting all the blessing now. So God gonna keep blessing you more and more as you go from strength to strength. Okay? One federation, thank you, Nevis. One Prime Minister, Stapleton-Harris, Honorable, whether they like it, yes or no. And you're going to be here for a very long time. That's why I say I give the golden buzzer. The golden buzzer means when somebody doing something good, you just have to buzz them straight to the next round or the next term. And you have a safe day, okay?
Thank you.
Right.
All right, thank you so much for your contribution to the program. We go back to the phone lines. Caller, you live and on the air. Good afternoon to you. All right, my apologies. Perhaps I was a bit too slow picking up that call. Let's go back to the phone lines. Call you on the air. Good afternoon to you.
Hi, good afternoon. How you doing?
Good afternoon. We're fine. Go ahead, please.
I have one question for the PM. I just tuned in. I don't know if you mentioned it before, but what if a senior citizen have to get her shots on Monday? What provision is put in place for her to get her shots? Will they come to her house, or will I get a pass to go take her to get her diabetic shot, or could he answer that for me, please?
All right, we can have an answer in just a while for you. The PM will take some notes and we'll get the answer for you from either the PM or the Permanent Secretary. So thank you for your question. We go back to the phone lines, call you live and on the air, and a very good afternoon to you.
Good afternoon, and good afternoon to the Prime Minister and the peers. People are not enduring the long lines in the hot sun for liming or recreational purposes. I would suggest that what we have seen is really a result of uncertainty and apprehension, mixed messaging, and a response that has not been adequately thought through. We cannot emphatically be told, stay at home, stay at home, stay at home, and then relax that edict and say people can go out and shop for 2 days. That's contradictory and defeats the whole purpose of a lockdown. Shouldn't we bite the bullet, enforce the 24-hour curfew for 2 weeks, and put the logistics in place where, if necessary, people can survive for 2 weeks without leaving their homes? And we cannot be certain that it will be just for 2 weeks, right? So we should be preparing, we should definitely put preparations in place for better logistics, better distribution, and resupply systems to enable people to cope. If, for instance, NEMA came up with a basic survival kit, basic food, water, medicine, that people can purchase on delivery at their home, for instance, right? Use the laid-off hotel workers in the preparation and distribution, use the taxi drivers and the bus drivers for island-wide transportation and delivery. People will not have to come out of their homes. So let's do things differently. Rather than these ad hoc measures, yes, the crisis is unfolding as we speak, but we can be more nimble. I think agile was the word that the Prime Minister used. We definitely can respond better.
All right, sir,
and I hope despite, just one more point, I hope despite the fact that the crisis is ongoing, that he and the Cabinet is thinking of life after the crisis. So I doubt it will return to normalcy anytime soon, and certainly we don't want what happened when he was part of the Cabinet in 2010 to happen again, as he referred to. Okay.
All right, sir. Thank you very much. I'm going to ask the callers to just try and keep it as brief as possible so we can get as many people in, as we have so many people trying to get through to us. We have a response to your comments and questions in a moment. Back to the phone lines you go. Call you on the air, and good afternoon to you.
Yes, good afternoon.
Yes, good afternoon, sir.
Yeah, Mr. McMahon, you probably have a lot of money and a big storeroom in your house. A lot of people ain't got the luxury or the money for a big storeroom in the house to shop. Some people probably will shop for 3 days and most likely a week. The government know what they're doing. You're asking the Prime Minister question about what they got in store for after the situation. Again, the government know what they're doing. They would know how to handle that. You always come with some kind of negativity. Don't care what the government, it does not please you. Good afternoon.
Good afternoon. Thanks for your contribution. Back to the phone lines we go. Call you live and on the air. Good afternoon.
Yeah, Mr. Bacchus?
Yes, sir.
Yes.
Dr. Gregory,
yes,
just 1 minute this time, okay?
Yeah,
just 1 minute. Yes.
Yeah, I'm quick to say
Go ahead.
First of all, yeah, right, good. First of all, the Bible does tell us in many passages that we are to obey the government, but it also tells us that when there is a clash between the government and the word of God, when the government is demanding of us things that are contrary to the word of God, that we should obey God rather than man, according to Peter and Acts. And we see from Genesis to Revelation that the saints, many of the time, disobeyed government and end up in jail, executed, lost the properties and that sort of stuff. So therefore, there is a limit to the power and authority of government.
What is your point, sir? Gregory, yes, sir. What is your point you're making exactly? Are you telling people to disobey the law? What are you saying?
What I'm saying is that when it comes to solving our problems, we should do so within the limits that the Bible has given government and not go beyond it.
I understand. All right. Thank you very much. We go back to the phone lines. All right. Seems to have missed that caller. 4660989, 6620989, 7620989. We go back to the phone lines. Call you on the air. Good afternoon.
Hi. Good afternoon. How you doing?
We're doing fine. You're live. Go ahead, please.
Yes. I'd just like, my question is about the quarantine and the days given for shopping. I'm just concerned that method of quarantine on, quarantine off might be anti-productive in that it may, allow for the population or portion of the population to reinfect themselves. I was wondering, can we think about potentially having another method of allowing the population by maybe constituency and times, probably have days apart where only a certain constituency or certain areas can go shopping and, mix it up that way versus everybody will, have a day or however it was to shop, which was chaotic. I'm just curious.
All right. Thank you so much. Those questions will be addressed in just a moment. Our numbers are 4660989, 6620989, 7620989. Okay, we're going to go now to the Prime Minister and the Permanent Secretary for some responses. Callers, we're going to ask you to hold a minute, and let's get some responses from the Prime Minister and the Permanent Secretary.
Thanks very quickly. For the caller, we do not have a quarantine on and off. Quarantine, and the Permanent Secretary perhaps will deal with that. If you are under quarantine, the time frame is stipulated, and you are in fact expected, once you're under quarantine, you would not go anywhere. So the regulation with respect to shelter becomes even more important when you have been put under quarantine. I should say that we have also added resources to ensure that the quarantining is effective, and in this regard we have set up a task force headed by the acting controller of customs and embodying other persons, John from health, John from the police, etc., to make visits to places of quarantine and to ensure those who are under quarantine, particular home base, are in fact in compliance with it. In one particular case, for example, we had 24/7 military personnel available around the particular home in which some persons were being quarantined. It's not an on and off. It is that there's a prescribed time frame within which persons are under quarantine, and the health and the other agencies will take note, do the monitoring, and make the necessary decisions. Quarantine generally is for 14 days. The idea of the zoning of shoppers, we thank the caller for that suggestion. There's no perfect model. In the BVI, they try an alphabetic scheduling. That didn't work. You still had the overcrowding, etc. As I said, our task force is looking at this particular measure. They have been in consultation with the Chamber of Industry and Commerce and other relevant parties, and early next week, if not before, I certainly will be in a position to advise how we will move forward in managing this. Ira McMahon made reference to the 24-hour lockdown. Again, nowhere in the world, in any democratic country, is there an absolute lockdown. It just can't happen. If there's an absolute shutdown, then you have no emergency technicians available. Then when the lights go, you can't call anybody from Skellig. You can't call the telephone. In other words, life becomes, as it were, a very odd place, for want of a better expression, where nothing happens. Because if we're talking in absolute, then there's nothing called essential workers. Everything must stop. So everything is in a relative sense, and that is how people are creating confusion. Lockdown for 14 days. Nowhere in the world it has happened. And it cannot happen. Because even in emergency, you have to empower certain critical services to be available. And that is why the model everywhere, not just here, in Jamaica, in United States, in England, is that you allow certain places necessary to the survival of people to be open on the defined time. So you can go to the restaurant in America even now. You can go to the pharmacy in London even now when they speak about lockdown. Because these services are critical. For the very point that I will make in one hand, life continues hopefully after the pandemic. And therefore, you have to allow people certain reprieve, hoping that they act responsibly and sanctioning them if they do not. So this notion about holding people locked down for 14 days, the caller made the point after him. Well, how they're going to eat? Who is going to be feeding 55,000 persons who may need? How are you in this time of crisis going to be able to discriminate between who at Bird Rock and who in McKnight going to need it? It's not a practical response to a solution. What is required is for all of us to encourage our people to be responsible, and we ourselves be the example that we want. There's no contradiction. That is why the model is at work. Here in Jamaica, in Antigua, in Grenada, is similar. You may have different days defined, as in BVI, they may say 3 days, and then they go on lockdown. Because the reality, which you cannot extricate yourself from, people are at different phases. Those who can buy for 1 month, buy for 1 month, stay home. You don't have to go back into the supermarket until that 1 month is clear. That will be good because you reduce the number of persons who are going there regularly. Those who otherwise need to go once a week because that is when they have the means to, you want to allow them that opportunity to go. But you're saying to them, do it responsibly. Make up a list. The old habit of going in the supermarket and I will pick up as I go, whether I need it or not, cannot work now and should not be encouraged. Have your list, determine what you want, you go quickly, you grab those stuff and you try and move. It's a new mode and it will take time. So I am not overly concerned that it's not perfect. I don't expect it to be. I see all these things as a work in progress because we are in a new world, a new way of operating. Just I would understand when someone comes and they outstretch their hand, Prime Minister, how are you? And I'll have to say, boy, we are in a new world now. Let's do the elbow. I don't expect that people will grab all the nuances just now. But we keep encouraging and inspiring them to be the best that they can, and we will get there. The notion again, well, on one hand, you say do the 24-hour lockdown, but get the hotel workers to go and distribute. What madness is that? What madness are we talking when we are trying to nitpick? There is no perfect way, but the way we are doing is a sensible way. And what it needs is for more people to comply with reasonable expectation. Who are the hotel workers you are going to take up out of their house and put on the street? To go where? To transmit the virus? We don't know. So we have to be careful what it is we are asking, even if all of us are searching for appropriate responses. So that is not going to work. Life after the crisis keeps me up and keep the cabin up every day. Life after the crisis, we know, will take some special initiatives. That is why even as we built out our response to this, we are talking about food security. Food security is not just for now, it's for after. That is why we have identified 100+ acres of land for persons to involve in food security. For life after, we must be stronger and more resilient. The investments we are making now at our JNF hospital, at Mary Charles, in our health center, and in specific areas of engagement, that is for life after too. Because the experiences and the lessons of this must put us in a better position as to how we are going to deliver health care. Certainly now, we have more ventilators than we have ever had in the history of healthcare delivery. That now means almost on every ward, you can have a ventilator when we have come out of this. In all of our hospitals we will have. So we'll be in a better place in relation to healthcare coming after the pandemic. The measures we are taking, some are for the short term, addressing the issues now, but they are to safeguard that stronger and safer future for all the people of St. Kitts and Nevis. The question with respect to the medication, how will all the citizens get that? The PS will handle that. The Golden Buzzer Lady, the reference was to a national service, independent service in Nevis. And while we were exiting the church, the then leader of the opposition, no longer is the leader of the opposition, Dr. Douglas was coming out. And I extended the hand because I was outside the church, had exited the church, as would be the normal protocol, in advance of others. Stood around to greet others. And he came out, was extended the hand in courtesy and in oneness of our independence celebration. He said he will not shake any hand. And my colleague, the Honorable Ian Patches Live, was there. Said, man, you can't be like that. You can't be bitter after now. You don't lose. This is the Prime Minister. Shake his hand. Dr. Douglas turned to the Honorable Patches Livet and said, "Move from in front of me or you'll show you down the stairs. I don't tell you I'm not going to shake no hand." That was a conversation, and that came up really for the first time. I said it publicly in a caller program so that people understand what you're dealing with. There are people still who are hurting and have a vendetta against the government. And there are no niceties that you can say that will get that out of them. The tasks which we are faced require all hand on deck, including a responsible opposition. But I am not going to go to sleep or not go to sleep pondering whether the opposition will act responsibly. I have seen what they are capable of. When the opposition created a fake news in the Team Unity band, inviting hundreds of people to go to Social Security on Friday for payment, knowing that there was no such instruction from Social Security. We know they want to create confusion. We know they want people to injure themselves. We know they are not well-meaning for the country. So I am not going to lose a lot of time having regard to the realities of life, which I know. Certain things may be nice to say, but then they practically be implemented. That is what we have to contend with. But we are open. People who have ideas, just as the caller can submit them. If they don't want, send them to the minister. Every ministry has a permanent secretary, which is the highest level in administration in our system of government. Write to the permanent secretary. Give your ideas. No one from the opposition up to this time has formally come and said, these are our recommendations. I have had letter, for example, from the Chamber of Industry and Commerce commending us and the stimulus package that I had outlined and making other suggestions. That is how a responsible entity does. I have had letter of commendation from the Bankers Association commending the government and its efforts so far and making recommendations for adjustment. For example, in the previous SRO, we had banking hours going, I think, until 2 o'clock. The bankers said, listen, we will need more time to do the back-end work. Reduce that Monday to Thursday until 12 o'clock. In the new regulations, we have restricted it to 12 o'clock. So you see, when we hear and see and get constructive ideas, it doesn't matter from whom they come. We are with that idea because we are putting the country above the politics at this particular moment in time. Same, we have met with the Evangelical Association and the Christian Council, and they are in support. They have given their advice. And it brings me then, finally, to Gregory. And Gregory knows the scripture a lot, but he just not wanting to make the adjustment. Maybe it would help if I read a memo from the Diocese of St. John's Bastille, in which the membership was advised all churches in the Diocese of St. John's Bastille will remain closed until April 30th, 2020. Continue to observe all directives by the respective governments of the island. I want to read it. Continue to observe all directives by the respective governments of the islands. Additionally, please refer to the guidelines from the Congregation for Divine Worship. May God continue to bless and protect all of us from every disease and sickness, especially COVID-19 virus, and may he bring an end to this scourge everywhere in the world. Bishop Robert Lianos. You might be familiar with this one. Reference number 38 of 20. I read that to show that the church leadership understands that these are perilous days and that the advice and prescription that is being given by the government and the World Health Organization is not at variance with what the church would want for the membership. For the church wants a healthy membership, serving God, praising God, and praying for the government. And what we are seeing here from the Catholic Church, I think this one is the same we have seen from the Moravian, Same we have seen from the Anglican. There is nothing in conflict with the prescription in terms of social distancing, minimizing the crowd with the Word of God. In fact, everything is in accord. And what we need to do in these times of crisis really is to attempt to be constructive. We will have different ideas as to how we achieve the same objectives, but we can't engage in nitpicking. Ultimately, in the end, the only legitimate authority with these things will be the government. And the government will, having taken all the ideas, may determine some of these are not ready for a number of reasons, maybe for security reasons, maybe for manpower, maybe for financial resources, a multiplicity of reasons, maybe because there is no consensus among different entities with respect to them. But when there is consensus and we come, let us work to them. It is not necessary that an idea may be bad, but that the time for implementation may not yet come. So we keep that in our back sleeve and we may have to go back. And that is why I said all that we are doing, nothing here is cast in stone. Because as new information comes, new knowledge, we are going to have to make adjustment if we are a responsible government. Take, for example, I've heard President Trump say, I will not wear no mask. It is only a recommendation. But certainly, if more and better determination is being made from the science, you will see he will make the adjustment. So that is where it is in terms of the way in which we do things, consultation, leading to solutions. We don't have it all right. That is why I come on the radio station hearing advice from everyone, from the highest to the lowest in the society, and bringing them on board to help us with our decision making. Madam Pierce, you may want to deal with the care for the elderly in these times, and I think there was a question en masse.
Yes, I think we responded to the question of mass, but I just wanted to support what you said in terms of the quarantine. You adequately elucidated the concept of quarantine, but I think the speaker meant the 24-hour curfew. I just want to say that the Ministry of Health, and by extension the government of the St. Kitts and Nevis, would continue to make the best decision to benefit the largest number of persons in the Federation. And so no one will be left behind. No one will be left behind. That is a concept that we embrace. And the Ministry of Health is very cognizant of the continued needs and care of our seniors, or vulnerable populations, or persons with diabetes mellitus, or persons with hypertension, or persons with cancers and other chronic diseases. And so we have made accommodation for these persons to be visited during the 24-hour curfew by community nurses who will be engaged in mobile services. And they will visit these vulnerable clients or critically chronic patients at home and administer the essential treatment such as insulin, Iprex. They will take their blood pressure and do whatever is necessary to facilitate their needs. Thank you.
Okay, we're going to go back to the telephone lines now. Here for some other callers. Caller, you are live and on the air. Good afternoon to you with the Prime Minister and the Prime Secretary.
Good afternoon.
Good afternoon, sir.
Good day to the Prime Minister and good day to the doctor there. Now, Mr. Harris, I want to congratulate you on the good work you are doing for the nation. I drive and observe when the police them is going around and allow speaker and telling them to stay, I think it's 6 feet apart from one another. I think the police them are doing a good job. And the line gets longer and longer. Today to me was worse than Friday with the line. But the people them they shop by the budget. They don't have a big budget to buy food and rest down for things. They just shop by what they need. Maybe they don't need to get the proper refrigeration to store extra piece of meat and those kind of things. So as I know that you and your government are trying to work with the people and them, and I think the people are saying it's a nervous. We're good stubborn, but we appreciate what you and your government is doing to assist the people in food. And then, Mr. Prime Minister, another thing you mentioned about the mask. The young ladies and them who got the mask them selling, I think you said about $5 to $10. Because Sun Island one is $20, sir. And I made to understand that, yes, sir. Yeah, $20 for their one, right? But the ladies and them who making the mask, I think they should take a chance and drive around in a car and sell the mask where they see all these people line up and try and get rid of them so the people them could be more healthier for the nation. And the Prime Minister and your team and the team that's doing the corona thing, God bless you all, and God will see to all that everything go good for you all. You have credit in anything you do. But who God bless, no man curse. Who God put together, no man put asunder. And I remember in England with the thing, the powers that they had, till Sir Winston Churchill. So your name is Sir Winston Churchill. God bless you, sir. Have a good evening. Thank you.
Thank you, Mr. Rock. Let's go back to the phone lines. Call you live and on the air.
Good afternoon, Mr. Bacchus.
Yes, sir. Good afternoon.
And good afternoon, Mr. Prime Minister.
Good afternoon, sir.
Good afternoon.
Claudius Harris Gums, Mr. Bacchus.
Yes, Mr. Gums.
Yeah, long time I've been calling to Inside News, and I was the champion of Inside News on Saturday, Mr. Bacchus.
I think you called in the right time, though.
All right, good. That's a fact, Mr. Bacchus. So this afternoon, Mr. Bacchus, right, I want to congratulate the Prime Minister and his peers because, Mr. Bacchus, they love the country. They are people's person. They didn't have to do it. Here you have the Prime Minister now taking time out of his busy schedule to be on the radio day after day, informing the people of this country and telling them what is happening. Now, what else could you ask of the PM? What else could you ask of the PM? Apart from all those initiatives that he put in place to support the people of this country in a time of need, what else could you ask the PM? Mr. PM, I want to publicly thank you for doing a good job. Very good job. And I want to say, my good friend always saying that people crucify Christ and worship the devil. So I'm saying to you, Mr. PM, don't worry. Be strong and courageous because your reward will be in heaven. So don't worry. People say continue doing the good works that our people of this country, right, will feel good and be thanking you for being a part of the good things that they've been inheriting for all this problem that we're having in the country. We have opposition in this country that supporting what the government is doing because they're not in charge, because they're not in power, They're criticizing everything for no reason. And so I want to support the Prime Minister in something he said earlier, that there was a lot of food supply in the country. And that's a fact, Mr. Bacchus. I could support the Prime Minister 200% on that. We have Tropical coming in every Tuesday, right? We have King Ocean by Horsford coming in every Monday. We have Crowley Hops Enterprises coming in every Monday, right? We have Innovative Services by Betty and coming in every Monday, Tuesday. We have the local vessels, so to speak, coming from St. Martin, Royal District. We have Adike coming in every Monday. We have Karma from St. Martin, St. Thomas, St. Croix, coming in every other Monday. Monday gone, Karma was here, and Adike was here We can't go bringing personal food stuff and so on to people in this country. So there's a problem about food supply. We don't have to rush and fill up the supermarket then. We have enough food to keep us in the year. People got plenty of food in the house, Mr. PM. Because we have the supplies, the ships them coming in week after week, because the port ain't closed down and bringing in supplies. Now, Mr. Bacchus, I want to say to it, and I want to say to the people of this country, please adhere to what the Prime Minister said. If he says 10 years, because it is better for us. It is better for the country. Mr. Bacchus, I in my house today, you know, and I cook a small pot, right? With my good old friend, Mr. James and Mr. King in mind. And then I said, boy, maybe Mr. PM and you, Mr. Bacchus, will get some of the chicken piece of. You understand? People need to do that. Sell your house. And a lot of things to do in your house. You do some cleaning, Mr. Bacchus. You don't have to pay somebody to clean your house. You're home now, clean up your house, mop up your house, wash down your window, change your curtains and so change your bedding. Man, there's so much things to do. Go on your phone, call your family, talk to family abroad, locally and abroad. Talk to them and discuss the whole matter of the situation. If you hit the family, you don't deal with it. That's what we need to do. Stop this farce and this propaganda out there and sending it to people. You have to turn with that. You have to come together as a nation, as one people, and deal with the situation. Thank you very much, Mr. Bacchus. Good afternoon, Mr. PM and your peers. Thank you for coming on and advising the country. Thank you very much.
And thank you very much, Mr. Gomes. To go back to the phone lines, call you live and on the air. And good afternoon to you.
Yeah, good afternoon again, Mr. Bacchus.
Yes, sir. Good afternoon.
Yes, that's what it is.
Yes.
We have the Permanent Secretary here, and we have the Prime Minister as well.
Prime Minister again.
Yes.
Mr. Prime Minister, you don't bother with them. Don't bother with them. You're going to lock me down in my house for 2 weeks? I mean, I'm going to deep freeze. I mean, you have to make, you have to adjust for certain things, but I think that the 3 days is working well. Really working well. And as for that Christian guy there, tell me any country in the world who is following the Bible to the letter and ain't got no problem. I reckon to tell me. And for the next caller who called in there, I think there was a program he was on with Mr. Bacchus, I think it was, and he talked about the $1 billion. Let he call you and tell you where you do the $1 billion that you met there. That's all they want. They want the government fall, and you ain't gonna fall. And you're doing a good job. I can't be locked up in my house for 2 weeks. You're doing a good job, Mr. PM. Continue. Let's go where they're going. And as for the one who can shake your hand, you can't turn the man and he become Prime Minister. He ain't gonna like that. What you gonna shake your hand for? He turn your way. And you now become the Prime Minister. He be able to deal with that? Let's go where they're going, man. Have a nice day.
Have a good day, sir. Thanks for calling. Let's go back to the phone lines. Call you on the air. Good afternoon.
Hey, good afternoon. Mr. Bacchus.
Yes, good afternoon, sir.
Did you ask the Prime Minister the question for me what I posed to you? If I know everybody what he organized to give everybody, but I wanted to find out was the disabled people who get disability gonna get anything too?
All right, thanks for calling and asking it yourself, right? We'll get a response in a minute. Thank you so much for that.
Okay, thank you.
All right, thank you. We go back to the phone lines and get another caller up. Call you live and on the air. Good afternoon.
Hi, thank you for taking my call. Mr. Bacchus.
Yes, sir. Yes, Val.
Good afternoon to you.
Good afternoon, Val. Go ahead.
And Mr. Prime Minister, good afternoon to you. Mr. Bacchus, I think that this is my personal way of thinking. Why we are seeing so much problems with some of our nationals here in St. Kitts, especially those who in lines and things like that, and are not obeying to the rules and regulations that were put down by this government or by the authorities, is because of what they hear in the leader saying of their party. If you look at some of them, the way they're carrying on is because they're not listening to what the government is saying. They're listening to what the leaders are saying. And listening to their leaders, when you listen to their leaders on radio, have you heard any one of them said, yes, do not go outside, stay inside, the curfew is on, behave yourself in the lines, stand 6 feet away? You're not hearing them say those things. They're speaking about the negative things about the PM. The PM is not the country. Listen, the coronavirus don't love men. They do not love men. The coronavirus is against men. It hates men. And let me tell you, men, mouth, eyes, and nose. That's all I have to say. Thank you, sir.
Thank you for calling, Val. We'll go back to the phone lines. Call you on the air. Good afternoon.
Hi, Mr. Bacchus. A very good afternoon to you.
Yes, sir. Good
the
afternoon.
Honorable Prime Minister and Permanent Secretary.
Good afternoon.
I'm just calling to find out in my case. I have a medical problem which requires sometime I have to go to the hospital because I had a triple bypass heart surgery, and sometimes I have to go to do an EKG if I'm beginning to get active. Would I be able to go, or should I get to the police to get permission? On the other hand, I live alone. I'm a diabetic. My sister and my niece cook for me, which means I'll have to get some means of going for my meals because they're not coming out. They've made it abundantly clear they're not breaking the law. So in that case, I'd have to arrange with the police for me to get permission to go A, to the hospital, B, to my sister or my niece. Am I correct? Because I'm a law-abiding citizen. I follow the laws of the land. And for all those educated persons with the Bible, I'd like to refer them to Psalm 91. I think we ought to do that twice a day. And then we'd see we have to abide by what the law says and what the Word of God says and stop being overworked with the Bible. Some of us read the Bible and we're confused and we try to confuse other people. So I'm going to listen off air, and I'd say again, God bless the Prime Minister, God bless the Federation of St. Kitts and Nevis, and I would like to say thanks to all those persons who gave me in hand at the supermarket yesterday. Then I recognize we are all loving people now. So thanks to everybody, God bless, and have a God-filled weekend. Bye-bye.
And thank you very much, Mr. Fritz. We go back to the phone lines. We hear from this caller, and then we're going to hear from the Prime Minister and the Permanent Secretary. Call you live and on the air. Good afternoon. Thanks for calling.
Good afternoon, Mr. Bacchus.
Yes, sir. Good afternoon.
Good afternoon to the Prime Minister. The Prime Minister, my name is Frederick Dyer. I have a problem. I've been working down at the Urban Development Corporation, almost going in for 15 years, and I'm not getting no respect from the head come right down. This is the situation I'm going to ask you. The gentleman that's working with us is a Sabbath, and knowing that people can't go to churches, I asked him as a supervisor and an assistant supervisor of chief if it is possible that he could come and do. He said if it have to, he will come in and work. Is he breaking the Sabbath? Because people have been calling me and telling me if he could work now, when the curfew finish or whatever, he should be able to work on Saturday. Is he not carrying out something from what the Lord wants him to do? By obeying, the country is in a crisis, and we all have to take heed because we are short staff of security officers because the majority of them living in the country and he is living in Bastille. Is he breaking the Sabbath or the law? So I will like you to give me an answer, sir. Thank you.
Well. Thank you very much for your call, sir. Mr. Prime Minister, I wish you well, sir.
Thank you. You want this to go? You want to come out of PS first?
Okay. In terms of the caller who called about the medical condition and being a diabetic, I wish to advise the caller that I indicated before that we are going to take care of all our vulnerable citizens. And so measures are in place to facilitate your needs. There is a hotline of 311 that you can call and indicate your needs, whether you require your insulin or whether you need to go to the hospital, and you would be responded to accordingly. So that should take care of the concern that you have. The hotline is 311. It has been working on a 24-hour basis, and we have been receiving some positive outcomes regarding it. And so we would want all our vulnerable clients and citizens to call that number and basically indicate what challenges or issues you may be having so that they can be addressed in a timely manner.
Okay. Thanks. And just to wish Derek Fates all the best, and I think his own particular situation highlight the practical difficulty when people speak to a 24-hour lockdown. How will somebody like him get the care and attention? If you are in a prolonged lockdown, it just wouldn't happen in a good way. I want to thank him for his knowledge of the Bible and giving Psalm 91 is one of those psalms that the people generally give to me. And I'm happy that he had a very pleasant encounter at the supermarket. So even when it is challenging, really, there are some people for whom the crisis has brought out the best. And we have to commend those who are bringing the best to the fore in their service, in their respect for each other, in their help for those who need the help. And so I want to applaud those who were part of that group that Mr. Freites commended just now. To support Claudius Gums, there's no shortage of food, there's no need for people to engage in the hoarding of food when you can get it next week and the week after and for the next 8 weeks ongoing, because there's no disruption. All the major cargo lines, the Tropical, the Crowley, etc., are coming, and they are coming on schedule. We had an interesting conversation with about the mass and the pricing. The best price I have heard is from Lynette Bonaparte, New Road Housing, $3 for children, $5 for adults. I hope I'm quoting her right. And if not, WinFM will perhaps make up the difference. And then there is Kiwani. I gather she is at Baker's Corner. And we have Sun Island. I've heard Sun Island price ranges between 10 and 15. I have spoken to Mr. Mahage, and this price really will come down, because we believe that better can be done in this particular moment of time. I want to make the point, though, everyone can get a covering of their nose and mouth, and I think Madam Pierce may have made reference to that. It doesn't always have to be someone made by an outside party. You can do your own. In fact, in other countries, they're encouraging kerchiefs and other things that people can use. Any cloth material, you can sew, make your own design, make your color, because in these circumstances, anything that restricts would be helpful. All the way from Ontario, Canada, and I hope I'm not making the talking point. A good friend, Brenda Foreman, says to me regarding the mask, and she shows me what she has done, a lovely embroidered mask. People can be creative. They are capable. They must go, if they must go out to get what they need, they can use makeshift masks and they will help. They are not perfect, but will help to keep a cough or a sneeze away, plus social distancing as well. All these things help to reduce the risk. And these masks that are being homemade, that are being made by Bonaparte, that are being made by Sun Island Clothes, they can be washed, so they are reusable. So people can bear that in mind, and I want to commend these people for their suggestion. So if you don't have the money to go and buy at Sun Island, listen, there are other avenues. Use some other covering, and persons have identified some. Make your own. Cover your nose, cover your mouth. That helps. Anything now that helps with the covering is to be preferred than going bare. So we want to commend that, and of course you can reduce the price. We will continue, as it were, to work to ensure the lines are more manageable. Of course, It is people taking personal responsibility. If you live in Buckley's and you can get your items in Buckley's, there are several shops. Why come downtown? Why go to Best Buy? Why go to Rams? Why go to any of them when those things are available and you can help by being one person less in the line? I expect that the lines will be longer if we are implementing the 6 feet distance as opposed to people being jumbled up. So again, that is why we are saying, make a conscious decision. If you can afford this 14-day lockdown, just buy your 14-day things. Take yourself out of that queue, out of that line. Let those who must be the one who are in that particular line. The caller with respect to the urban UDC and the security services, that is a matter which Mr. Philip must address, because this is about the second time we are hearing the caller call. The leadership of UDC, the urban development must take action, and I will bring this to the attention of the minister. That is not a matter really that we should be having at a time like this. But I want to thank the caller anyway for taking time and bringing the lapse, if you will, in terms of that security service, if it exists, to the attention of the public and to me. The caller that raised the issue, I want to thank, of course, Hardis Gums, Val to call in and to say, by and large, we have to have an opposition that is committed to the country. And at a time of crisis, you let down the parties and political activity and be a constructive intervener on behalf of the country. You give the people the advice, you encourage them to be supportive. You don't tell them go Friday morning and flock up Social Security, so that the people there could perhaps become the victims of that particular unpatriotic action by the opposition. I think I would have covered most of the questions. Some of them were commendation, to say thank you. If I have omitted any, Mr. Bacchus, your memory is better than mine. You can please advise.
The disabled.
The disabled. What was
anything from the stimulus?
Right. The disabled person, a person who is disabled, should be entitled to make an application to Social Security. There should be assistance for that. And there is also under the Social Services Program, there is assistance that can be had. If there is a specific case and persons want to draw that to attention, I am available. The Ministry of Social Development is available, and you can certainly get that information to us, and we will respond to the plight of the disabled in the community. Whatever we can do to be helpful, and wherever someone who ought to be benefiting is not able to, we will make the necessary correction, because this is an all-of-society approach. This is a government that is compassionate, and our heart is with the people and our mind. So we will do the best that we can in the context of the resources available to us. And the Permanent Secretary of Health keeps saying no one should be left behind. Certainly with respect to our social safety net, we would not want anyone who reasonably ought to be benefit from our social safety net programs to be excluded.
Thank you very much, Mr. Prime Minister. Well, it's time now for us to begin wrapping up the program, but I'll see if anyone wants to get through with a final call to the Prime Minister. You have a chance to speak to the Prime Minister of the country, to ask a question, to offer a comment. And we're going to give you just a few seconds to see if you have the time to call 4660989, 6620989, 7620989. If not, we're going to wrap it up for today, and we'll invite parting comments from the Prime Minister. Mr. Prime Minister, the phones are quiet, so I think you've probably answered most of the questions. I just have two things I want to put to you and invite a comment from you in the first instance, and perhaps later on we may discuss more in depth. It seems to me I was looking at some of the footage from around the Caribbean, Barbados, BVI, and I drove around St. Kitts today and Friday having a look at what was happening. It seems to me we have to have a conversation about shopping patterns and some of our habits these days. It seems to me that a lot of people are consuming on a daily basis, either cooked food or prepared food, if you like, or they either don't have the money line to have the storage, or they're just going from day to day. I think that's a conversation we're going to have because when you see the lines of the people, the BVI, Barbados, Trinidad, Guyana, but Guyana has no lockdown as yet. Guyana is still counting the ballots from the last election. But that's another story. But yes, I'm just thinking that perhaps the whole issue of how we live, how we shop, how we eat may have to be a conversation piece for another time. But sir, I'd like to invite your final comments for today, and of course, final comments from the PS. Perhaps the PS can go before the Prime Minister. We give the Prime Minister the final comment. PS, your final comments, please.
Yes, thank you very much, Mr. Backus. I want to conclude basically similar to the way I started. And I want to reiterate that the Ministry of Health is ready to fight the coronavirus. I want to say that we have heightened our strategies, that we have procured additional supplies of equipment. Recall that the virus is of a respiratory type, and so we have secured large numbers of equipment such as ventilators, defibrillators, cardiac monitors, stretchers. We have large amounts of medication such as Tamiflu. We have also ordered hydroxychloroquine, and we also have large numbers of nebulizers and oximeters. So in terms of supplies and equipment, we are prepared. We also have large amounts of PPEs, personal protective equipment, gloves, sanitizers. We said we are ready, and we are indeed ready. I also want to say that I think the Federation is aware that we have secured the services of additional health personnel from the Cuban government to bolster our human resource capacity and capability. These persons will assist us in the community and, of course, at the institutional level. They are currently in quarantine, but should be emerging soon based on the fact that they would have been quarantined for 14 days prior to their arrival to the Federation. And Tuesday, I think, would be a total of 22 days where they can emerge from that facility if we need them to be. I also want to say that we are prepared in terms of our physical infrastructure at the institutional and community-based levels, with designated areas for assessment and treatment. I need to indicate that our private ward is completely equipped and transformed to accommodate cases with the virus. It now consists of 8 ventilators. The accident and emergency area of the hospital has been transformed appropriately and partitioned to accommodate the normal accident and emergency cases, and another area with persons with flu-like symptoms. It is also equipped with specialized equipment such as ventilators, infrared thermometers, nebulizers, oximeters. Health personnel have been undergoing training in the donning and doffing of personal protective equipment and the management of patients with the COVID-19. I also want to speak to testing, because there has been much talk about the amount of testing that the Federation has been engaging in. And as of today, we are well aware that we have 9 cases of the virus confirmed. We have tested in a small population of about 55,000 persons. We have done 146 tests. 146 tests. Mr. Bacchus, when compared to the regions of larger countries and larger populations, and I'm quoting from the PAHO statistics, Antigua and Barbuda, with 8 confirmed cases, has done 40 tests. This is from PAHO. Barbados has done 382. Dominica, with its very large population, has done 185. Grenada has done 45, with 12 confirmed cases. St. Lucia has done 139 tests. St. Vincent has only done 31 tests. And I want to reiterate, St. Kitts and Nevis has done 146 tests. Compare that per capita and per population, Mr. Bacchus. So we have quadrupled our testing. And I want to debunk the notion that we are not testing. We are indeed testing because the statistics are showing that. And we have the data and the evidence to show that. So I want to end again on reiterating the fact that we are all prepared. The Federation is prepared. And I want to make a clarion call to the people of the Federation to implement the basic protective measures against the virus. I want all of us to stay aware of the latest information available through the Ministry of Health and the local task force. I want all of us to take care and practice our personal hygiene by washing our hands frequently with soap and water with an alcohol-based substance. Let us maintain the social distancing, staying at least 6 feet away from each other. Let us stay informed by our government and our Ministry of Health. Let us follow the guidelines of staying home when advised. And let us protect each other. Let us protect ourselves. And may the Federation and St. Kitts and Nevis stay safe and contain the spread of the virus. It was my pleasure being here today.
And thank you very much.
Permanent Secretary, Ministry of Health.
And thank you. And thank you very much, Dr. Delores Stapleton-Harris, for your wrap-up and for being here today to share information with the public. We now invite the Prime Minister for his final comments.
Thank you very much, Mr. Bacchus, and let me thank you and thank WIN for facilitating greater public awareness and information sharing in what is the challenge of the century, the pandemic that we are now fighting and doing a royal battle with. I want to commend the Permanent Secretary in Ministry of Health, who has a long professional career in health services as a health educator and a administrator, as she was president acting of the CFBC College before she was transferred into the Ministry of Health to bring the wealth of practical experience and learning in health matters. She now has a PhD in matters of policy and leadership, and so I feel very comfortable that we have a good team at the Ministry of Health. And in that regard, I also want to commend the Senator, Minister Wendy Phipps, for her leadership of the ministry at this particular moment in time, and all of the health fraternity for the contribution they are making. I feel satisfied that as a small country, as the smallest independent country in the hemisphere, we are doing better than most. And much of what the PS has said has confirmed that. We are doing better than most in terms of testing. We are doing better than most in terms of our preparedness. We are doing better than most, and at this particular juncture, the health fraternity feels that we are ready to undertake that war. The missing link is for us to ensure that we have the buy-in from all in society. It is a different time. It is a turbulent time. It is a time of crisis. And some of those things that we will normally do, we will have to undo them because the urgency of time and the saving of lives demand that we do so. Yes, it will be a period of inconvenience in shopping, in traveling, and several other things. But we have no choice but to endure and make the sacrifice now, or it will be more severe for us to make the adjustment later. I want especially to urge that everyone, as far as practicable, observe social distancing, keep 6 feet apart, stay at home as much as you can, take care of your family, clean your places, ensure that your family's comfort is being attended to, look out for the elderly, and of course keep praying for our country. You raised the matter of our shopping patterns, and clearly from what you'd have seen in the BVI, in Barbados and elsewhere, it's as if all of us have the same challenge. How do we get us as a people in these particular moments of difficulty to change? We are accustomed every day, some of us go to shop. Whether it is for bread, every day we go because we want the fresh bread. And that kind of cultural condition remain with us even in a moment of crisis. So it is something that we have to look to and pay attention to. We do a lot of impulsive buying, and our supermarkets and them are places where people go, in some respect, for casual encounters, meaning to lime, to go along with a friend, etc. All these things now we just have to do a revisiting based on the hard experience of the pandemic which we now face. I want to look to the future because some of the conversation in which you have invited me to engage in terms of shopping pattern are matters that are going to evolve in time to come. I see that in the future we are going to have changes in the way we do business, certainly in the operations. We are now have become comfortable or see the necessity of allowing a significant portion of the workforce to stay and to work at home. Will we ever be able to return 100% to everyone in the workplace when we have had the benefit of this lived reality? That is going to be a conversation for the future. How we organize work, and where do we require in that reorganization our workers to be. Then we are seeing as this develop, new products and services emerge, even as some old ones may disappear. We have, for example, I think it is Roger Bisbane, Hibiscus, now offering sanitizers. That is good, and that is something we hope will continue even when the virus would have gone, because our people will become acculturated to new modes of hygiene and sanitation. The question of the mask now, and having instead of disposable masks to reusable masks, becomes now a matter in which an entity like Sun Island could now contemplate for export, so that that product can continue long after. I see, for example, that in the future, we are going to put more attention on acquiring specialist skills, particularly in ICT. And this becomes critically important given what we are insisting upon now, the opportunity to work at home. And even as we look at that, in light of some of the challenges in the health sector, largely based or man-made, to the extent that we need to enhance our human capital, our scholarship program will have to take us closer to achieving desirable goals by targeting special areas in healthcare delivery, in specialist services in healthcare, so that we are stronger and better. We will have to look at decentralization of services. Certainly the need for modern quarantine facility now looms large in the context of St. Kitts and Nevis. Our modes of salutation and greeting, the warm embrace that we will normally have, those things we'll have to reevaluate, and we now are forced to evaluate them in the context of the new reality. The sanitation services and the support, all of them have now took on a special focus in our environment. I want, on the note of thank you, to identify, and I'm going to close on that really, a number of entities that have come forward and done a good job in terms of giving support to the government, giving support to our schools, giving support to private people in their moment of need. And allow me also to say that this has been a partnership involving the federal entity and the Nevis Island administration, and to commend the administration of Mark Brantley for the cooperation. Clearly, there will always be room for improvement, and we look forward to those improvements for the benefit of all the people in St. Kitts and Nevis. But as I commended the health practitioners here, I want to commend those in the forefront, in the island of Nevis, in healthcare, in immigration support, in security service generally, and to say how deeply appreciative we are of you and of our collective efforts. You are bringing the best of St. Kitts and Nevis to the fore. I commend the cable that has partnered with the government in several initiatives, and Miss Pat Walters has been in the forefront of that, expanding broadband services, providing for hotspot connections, etc. And I gather they have provided support with internet services in some government-owned quarantine facilities or government quarantine facilities that have been under the control of the government. I want to commend Flow, which has contributed to the Health Emergency Operations Center and the development of the hotline, and it has also donated some 8 top-of-the-line, I am hoping, mobile phones for use by the health fraternity. So, Mr. David Lake, we are beginning you up, and we want to thank you. We are bigging you up, and we want to thank you and the company. I gather Digicel has also provided some support. We want to acknowledge the support also of SCASPA, that has provided a container to facilitate, improve, or increase storage for the health sector. TDC Group of Company, SL Horsfords, they donated some N95 masks. The Ambassador of Taiwan, His Excellency Tom Lee, donated 10,000 masks in the first instance, 4,000 N95 and 6,000 surgical, and there are some further supplies which are to come. I am advised that some 40,000 additional masks should be coming to St. Kitts and Nevis, courtesy of that government. Kevin Zhang of the Chinese King Pavilion Supermarket has donated PPE, that is personal protective equipment, and 7 infrared thermometers. We are grateful to that institution for its support. PAHO has donated test kits, transport media, viral transport media, and other supplies. Reggie Francis of East Bastille, he has donated scanners, and he has offered 2 of the family residences for purposes of quarantine. We want to thank him and thank the family that he was one of the first persons really who came out and give such a generous contribution to the health sector. Dr. Frank Laws is overseas in America. He specializes in heart care, as I understand it, and he has donated some equipment to assist. We have the University of Medicine and Health Sciences, UMHS. They have donated 42,000 gloves to the hospital. We have a well-known member of the legal fraternity. They wish to remain unknown, but they have contributed $21,000 to cover the cost of tests to be done at the next Dr. Jeffers lab. That is one of the labs locally that does the testing for coronavirus disease. Then we have Mr. Denrick Connor of Sagicor. He has donated through the company US $5,000 to the nurses for their role in the fight against this pandemic, so that will allow important items to be purchased or procured. We have Mr. John Giuliani of the Royal St. Kitts Hotel, Forerunner Jactar, and he has donated several cases of gloves and N95 masks. Then we have Mr. Alex Nisbet and the St. Kitts Biomedical Research Institute. They have donated several hundreds of FDA test kits. And we have Scott Keynes, who has made available some vehicles for national security purposes. The list is added to each day as more people show their kindness, their generosity, and we want to thank them all. The International Atomic Energy Agency, IAE, and the OECS Commission have pledged supplies and equipment. And so, by and large, we have some over 21 entities that have already come forward. I want to thank them from the bottom of my heart. Their donation, their support, has helped St. Kitts and Nevis to be as ready as the Permanent Secretary of Healthcare has just outlined. I want, in the end, finally, to say, as we embrace this all-of-society approach, where everyone has an idea, we welcome the idea, and we welcome their support for the undertakings and the actions of the government. I've been asked by some people to make an appeal to landlords, some of them who have gotten the moratorium from the bank as a result of the intervention of the Monetary Council, of which I am a member representing St. Kitts and Nevis. The advice is that the landlords, each of them, must give some relief, whether the tenant is in McKnight or Bird Rock or Matinley. We are asking all landlords to give some measure of relief at this time, including those who are in commercial properties, those whose tenants are in commercial properties, so not just residential, commercial too. We are asking that employers do not take advantage of their employees, that where they are required to come out to work, particularly in periods of shutdown, they are asked politely, and we will ensure through the Labor Department that there is no penalty attached to any worker who decline the offer to work when the country is in shutdown. We have had one or two special cases where, for example, a pharmacy may need workers out, and so on, and they are given exemption. But it is not compulsory that the worker works in certain circumstances, and that is why the focal point of the regulation says stay at home unless there's a compelling reason. So we want employers to be sensitive and with every worker observe all health protocols, of course, and assist where you can with their welfare and that of their family members. The supermarkets, of course, we want to encourage you to continue to be disciplined, to observe the social and physical distancing. We want to beg of you that you do not engage in price gouging. We will find it very offensive that in this time of crisis, persons are attempting to exact the highest profit and goods. We will not countenance that. And so we urge the best behavior from all. Again, I will close with what is now common knowledge. In times of crisis, we can have the worst or the best being exhibited. I want for my beloved country and people that St. Kitts and Nevis, our citizens and residents, shine brightly in this moment of crisis. Do not be fearful, but be careful. The government and every responsible entity is with you. I want to thank the church and the church community for their prayers. And even as the churches generally have been advised to stay close, the opportunity for virtual communication is still available and is still to be encouraged. Where persons need to go individually, not in large groups, to their church to pray, that opportunity still avails to the people and to the membership. But even in your home, even in front of your television, you can still kneel and pray. I want to thank God for what He has done for our country and for where we are at. There is room for improvement. Let each of us be the best example that we can be. May God bless us, and thank you again to WinFM and to you, Mr. Bacchus.
And thank you once again, Mr. Prime Minister Dr. Timothy Harris, and of course the Permanent Secretary of the Ministry of Health. We'd like to thank our partner stations as well, and of course the essential workers in the studio, just keeping some social distance at the back there. Yes, well done. Congratulations, and of course we look forward to further collaboration as we all take on the COVID-19 challenges ahead of us. And that's the program for today. We feature the Prime Minister of St. Kitts and Nevis, Dr. Timothy Harris, and of course the Permanent Secretary, Ms. Delores Stapleton-Harris, on our program. And of course we want to thank everyone for being a part of the program, especially the cable, proud sponsors of Inside the News.
As social distancing becomes a norm,